Healthcare systems are struggling in many developing countries to meet the health needs of their populations. Women often suffer disproportionately from inadequate health provision, particularly where communities lack access to appropriate reproductive health services.
A woman's lifetime risk of dying due to maternal causes is 1 in 16 in sub-Saharan Africa, compared to 1 in 2,800 in developed countries. The poor and those living in rural areas far from appropriate health facilities are particularly at risk. 2 key Millennium Development Targets are to reduce maternal mortality and to increase the proportion of births attended by skilled personnel. Tanzania is facing a particularly difficult challenge. Rates of skilled attendance at birth have actually fallen in recent years.
Creative solutions to this problem are needed if Tanzania is to move towards its Millennium targets. As evidence points to the inadequacy of supporting traditional birth attendants, new ways of extending women's access to skilled attendance at delivery are being explored. In common with other countries in the region, Tanzania has in recent years seen a rapid increase in the private health sector. Changes in government policy in the 1990s allowed hundreds of private clinics and hospitals to open all over the country, many of these facilities providing reproductive health services, including deliveries on a fee-for-service basis. The consequences of this rapid expansion of private sector healthcare for safe motherhood are not well understood. In 2003, a research project set out to examine the implications of a relatively new development, that of midwife-owned private maternity and nursing homes.
The project aimed to better understand the private midwifery sector in Tanzania and to examine how it may be developed for the maximum benefit of communities, particularly those in underserved areas. This research was a collaborative project between the Florence Nightingale School of Nursing and Midwifery at King's College London and the School of Nursing at Muhimbili University College in Dar es Salaam, and it was funded by Health Foundation of United Kingdom.
The researchers conducted case studies in 9 districts across Tanzania. Districts were selected to include a wide range of environments, from urban Dar es Salaam in the east to rural Mpwapwa in central Tanzania.
Within each district, we used a mixture of methods to gather information. We consulted a range of people about the circumstances in which midwife-owned private services were operating. Understanding a range of perspectives from community members to health managers was central to building an understanding of the sector as a whole.
Currently, there are approximately 60 such midwives providing reproductive health and nursing services in many regions across Tanzania. These services are often provided by retired midwives, whose skills would be otherwise lost after leaving employment in the public or mission sectors.
They are really important because for sure the existing facilities somehow does not reach the whole population. There are population who cannot access these services. Therefore, there is a need really to introduce this system which will reach far down to the community level so that many people could utilize the services. And on top of that, we are facing a very big problem whereby the institutional delivery is really very low. Therefore, with the establishment of existing maternity waiting homes, maternity delivery units, I think these are being run by the skilled person. Some of them are retired midwives, therefore they'll be able to take care of these people who are not attending our facilities for delivery, and therefore will contribute to lowering the maternal mortality rate in the region.
In our community, a lot of women are still delivering at home, being delivered by TBAs, being delivered by relatives, and some women even deliver alone. So imagine, when we talk about reduction of maternal mortality, how are we going to reduce maternal mortality to a woman who has delivered herself, to a woman who has been delivered by an unskilled attendant? We need skilled attendants. And having private midwives means having skilled attendants going to the community to provide the services that we desire. There are many nurses and midwives in the society everywhere who are not employed. leave alone those, there are also retired midwives who have retired at the ages of 50, 55, 60. Those are still very strong in the profession. Some of these retired midwives are doing business like selling oranges, selling charcoal, even selling local brew. Imagine if these midwives could be on the job, delivering or seeing women in the antenatal services, or even giving advice, even referring them to district hospitals. How much more could we have done in safe motherhood?
Baada ya kustaafu kutoka serikalini, nilikaa nyumbani, nikaona akili yangu na uwezo wangu kama professional unadidimia. Halafu pia nilikuwa na wagonjwa wengi wanaokuja usiku kuja kuniamsha kwa sindano, kwa kuzalisha. Nikaona kwa nini nisianzishe tu kituo mahala ambapo wanaweza kuja wakapata huduma ambayo ni sahihi.
My name is Rabisante Sama, and I own my clinic which is known as Lina Nursing and Maternity Home in Dodoma Municipality. The reason for starting this facility was just for preparation for my retirement, and also I had developed a great interest in the reproductive and child health. Where I am really, there is no health facility, and women had to walk a long distance, about 5 kilometers, at least to reach the nearest hospital. So when I started there, they felt very happy, because especially when they get problem at night, they could get somewhere where they could be saved. Yeah.
Making maternity services more available in rural Tanzania will be vital if maternal mortality is to be reduced.
One advantage of services provided directly by midwives is that, unlike private doctors, they are often more willing to provide services outside the towns. Indeed, many retire back to their villages where women are in need of their skills.
My clinic is at Buhemba, 44 kilometers from Musoma town. Well, I started my clinic when I retired in 1998, because I thought that service is needed by that area, because it is far away from other health services. So I've been there for at least 3 years now. So they are appreciating my service.
Nafikiri vituo binafsi kwa kweli vinatoa huduma nzuri zaidi, kwa sababu kutokana na uzoefu ambao nimepata, utakuta mama ameandikiwa kujifungulia mawenzi lakini anakataa kwenda kule. Kwa sababu anaogopa pia kwamba kule mawenzi wagonjwa ni wengi sana, ni msongamano, hasa kwenye nyumba ya delivery. Unakuta sasa vyombo vimewekwa dakika hiyo havijachemka vizuri, huenda wakapata uambukizo kule. Mahali hapo unakuta wagonjwa ni wachache na tunachukua muda mrefu kuweza kuongea na mgonjwa, halafu tunakuwa marafiki. Lakini pale mawenzi unakuta hakuna muda wa kuwa rafiki na mgonjwa, kwa sababu ni mara moja twende, wewe una shida gani? Kwa hiyo unakuta hata shida zao hazijaweza kutambuliwa vizuri.
Nimekuja hapa kwa sababu huduma ni nzuri. Napenda kuja hapa kwa sababu kituo ni kizuri, tukija tunapokelewa vizuri na watoto wetu wanapimwa vizuri. Hata pia kupewa pole unafarijiwa. Wao hapana, inawasaidia sana. Kwa sababu wengine walikuwa wanajifungulia nyumbani, sasa hivi wanaona kituo kiko hapa, wanafurahi kweli kuja hapa.
It is often assumed that private sector provision is much more expensive for users than public sector care.
But the situation is more complex. We found that women face a number of expenses when seeking care in labor and delivery in public facilities. These include the cost of transport, which may mean tax late at night, and the cost of supplies such as gloves and syringes. And despite a national policy that maternal and child health services should be free, our study found that women are often required to make other formal and informal payments at public facilities. These charges are an important consideration when making comparisons regarding access to public and small-scale private reproductive health services.
In addition, uncertainty over facility opening hours, long waiting times, and fear of the type of care that they will receive all act as disincentives to travelling large distances to public sector facilities. Hours spent away from a busy household are also costly in terms of time and may be hard to justify to family members. So, nearby skilled providers who can be available 24 hours a day can be a more responsive solution to the needs of women if they use transparent and flexible charging structures. We found, for example, that many private midwives allow payment by installments for delivery.
I was facing a problem with mothers calling me from my home to help them. So I decided to open it officially. They are comfortable with my service. And they like it because I am charging a very small amount of money. So at least per month I get 20 to 30 mothers delivered at my health facility. And then they are happy with me and I'm happy with them.
Reducing the death and injury suffered by women through lack of access to maternity services is a huge challenge. And the number of professional midwives available to provide private services are relatively small. However, their contribution can be optimised by close collaboration with local health managers.
In Mbeya region, a private sector forum has been established to facilitate closer working.
For some years back, we did not have a good collaboration with the private sector in the region. We are working separately, public and private. So with under the health sector reform program, we are trying now to follow the public-private mix, and as the initiative of the region, we decided to establish now the private sector forum.
The Ministry of Health are promoting public-private partnership nationally, and many districts are now working to integrate the private sector into their overall health system.
Having these private midwives right at the community can assist in the health delivery for the mothers and the children at that community. So I think they are really doing, it's really necessary that we have such people at the community level.
We have found that many districts are realizing the important role that they have in ensuring that private services are well planned, supported, and supervised. The Ministry of Health has recently revised the guidelines for establishing private nursing and midwifery practices. These more appropriate regulations will enable districts to provide better support.
The study found that long delays in registration, infrequent or unsupportive supervision, and lack of ongoing training were impeding the development of these services.
Support from districts will be vital if the skills of these midwives are to be harnessed for communities. By helping such midwives to register their private practices, and by providing additional training, basic equipment or vaccines, health management teams can make these services more sustainable.
So for today I have got these skills, this knowledge. I think they will be very happy to be attended by me in a new skills.
Usipofundisha ukunga nani afundishe? Usipofundisha ukunga nani afundishe? Usipofundisha ukunga nani afundishe? Nani afundishe? Nani afundishe? Nani afundishe?